Yeah, I'll start. I'm Gloria Stringer with the Lake County Crisis Center. I'm the director there. Hello, I'm Estella Gomez, an innovator agent working with the Oregon Health Authority.
Hi, I'm Arvinder Singh. I'm the CHIP coordinator for Lake Head District, Lake County.
I'm Rachel Berry. I'm the new AmeriCorps Vista with OHA, working with the CHIP department.
I'm Diane Clay, and I'm with the Lake County Blue Chair.
Jamie Davis with Oregon State University Extension Service.
Brooke Kelleher with Food Corps and CHIP. Michaela Utley with Lake Health District, but we're Lake County Public Health. Daphne Greer, I'm with the Council on Aging as well as the Early Learning Hub.
Okay, Hill, Lake County School District 7.
Jack Thompson, Lake County Education Service District.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
James Williams, Lake County Commissioner.
I'm Jeremy Twait, I'm CEO here.
Susan Quintier, and the Revenue Cycle Manager for Lake Health District. And this is
Do we have anyone on the phone?
It's Shelley Kitrick with the Lapine Community Health Center.
Hi, Shelly. And we have somebody else?
And yeah, Maria Waters, Regional Outreach Coordinator for OHP and the Oregon Health Authority.
Hi, Maria. Was Michaela gonna be here for the meeting? Oh,
There, I'm
all right. Thank you, she is here, yeah.
Just that introduction.
Okay, I know that our vendor emailed out the minutes to everybody, but for those that didn't receive them by email, we'll just take one more read over the minutes and see if there is any corrections or additions.
I'll pass the motion to approve.
Is there a second?
I'll make it second.
All those in favor?
Aye.
The minutes are approved as presented. Okay, it looks like Maria Waters is up first with our OHP Sister Network.
Great, thank you so much. Yeah, so hopefully I'm kind of flying blind here, but Michaela in the room is definitely the local expert in all of this, so I'm hoping that she can help field questions and be my eyes and ears. So my name is Maria Waters. I am the Regional Outreach Coordinator for the Oregon Health Plan, overseeing Crook, Jefferson, Deschutes, Lake, and Klamath County. And my role is to manage the implementation and operation of the Community Partner Outreach Program, which we will talk about a little bit more today. For those of you who may not hear me on the phone often, I lurk in the background of these meetings each month and really look for ways and opportunities for this program and the LCAC to intersect to really achieve the goals and objectives that you guys have outlined in your meetings. And I think probably many of you may not know about the Community Partner Outreach Program, and others of you may have been quite some time since you've heard about it. So I thought it would be great to use this time, especially while you're going through the CHIP and the CHA, to be able to identify how this could be a partnership to help achieve some of those objectives. So the mission and vision of our program, we are part of the Oregon Health Authority, and we have bridged both Department of Human Services and the Oregon Health Authority, as OHP is a shared service of both of those agencies. And our mission is really to engage communities across Oregon to advance an equitable, responsive health system. Aside from this program, as many of you know, OHP can be somewhat inaccessible in that currently DHS offices do not have the ability to help people apply for the the Oregon Health Plan, leaving the burden to them to either use the internet, online resources through our website, or the phone to maintain and apply for their OHP. As we all know, that can be quite challenging for any of us, let alone folks who may not have reliable access to internet and or time to sit on hold for sometimes up to 5 hours. So we've created this team of people to bridge that gap. So really our vision in line with the Oregon Health Authority is to create a strong and healthy Oregon. Our team itself is comprised of 8 of me from across the state. Each of us have a designated geographic territory. We also oversee implementation of the Cover All Kids Senate Bill 558 program, which expanded OHP to also include undocumented children up to age 19.
I don't think she can.
And there are 3 additional kind of regional outreach coordinators just focusing on that population. We have an eligibility worker who is a specialist in some of the more complex cases that our team relies on. And then we have a business team and grants and contracts team. We do offer 2 grants annually. Currently, Lake County Public Health, and now obviously Lake Health District, is one of our grantees. So Lake County has received an annual grant. Michaela, correct me if I'm wrong, but I believe since 2014 to administer this program. Is that right, Michaela, 2014?
January 2014, correct. I've been in this position for 5 years.
Yeah. And for those of you who don't know, Michaela actually was really the founder of this program in Lake County. So she has overseen the development and implementation of the Community Partner Outreach Program for OHP since its implementation. So she is a huge resource to Lake County and a wealth of knowledge and information when it comes to this work. So as I mentioned earlier, we do a few key things to advance health across the state. First of all, we develop and engage a statewide network of all kinds of organizations, including medical providers, community organizations, like as in nonprofit organizations or other community-based organizations, state agencies, and county agencies like public health or DHS. And then also CCOs. So in your case, it would be EOCCO, who manages most OHP members in your area, really to reduce barriers for application and enrollment to the most vulnerable and also hard-to-reach population. So these folks are seeing those who aren't going for their regular primary care checks. They're not necessarily getting their immunizations or well-child checks. These are the folks that are very minimally, if at all, engaging with the health system. Additionally, the community partner organizations provide real-time feedback around areas including policy, processing and operations for OHP, hospital presumptive eligibility, which is HPE, the Reproductive Health Equity Act, the One System, and also HMA, which is our tribal population. So really, we depend on this network of organizations to provide feedback so that we can improve policy, processing, and engagement for each of these populations that we see. If it weren't for these community partners, the state would have no real-time way to identify barriers, problems, and also hopefully what's working with the system in order to make it as efficient and effective as possible. And then subsequently, through all of this work, really they're creating opportunities for regional and systematic strategic engagement with OHP. So really, hopefully acting as that conduit between the regional initiatives that you guys have there in Lake County with the rest of the state and the Oregon Health Plan to be more strategic at how we do it and to meet those metrics that we all talk about so much in these meetings.
Marie?
So our team operates.
Question.
Sorry, did I
have a question.
Yeah.
How does the Early Learning Hub fit in with all this?
So Kayla, do you want to speak to that, or do you want me to answer that?
I would be happy for you to.
Okay. So Up until this point, in Lake County Public Health has been our only grant-funded partner, which is normally it's normal for a county of Lake County's, I shouldn't say size, population, to have one grant-funded organization, but given the geographic spread of this area, obviously one organization can't do it all, right? So in a moment here, I will talk a bit about how we have about 350 organizations who do this work, and only about 25 of them get any funding. The rest do it on a volunteer basis. So all of that to say that Early Learning Hub does not receive funding from us. In an ideal world, there would be a strong collaborative partnership between Michaela and the other sisters from Lake County Public Health, or whatever other sisters the hospital might initiate. And not just the Early Learning Hub, but all of the other community-based programs that intersect with the eligible population, so that these folks have a local contact servicing, renewing, applying for, and helping them troubleshoot any issues with OHP. So I think the cool thing is, in this conversation, is that we're kind of at a blank slate a little bit, in that there's a lot of room to really nurture and develop some of these local partnerships to serve families to the best of our abilities.
Thank you.
I'm not sure if that totally answers your question, but as we move through, I think it'll become a little bit more clear as well.
Okay.
Okay, so my job is to train and certify community partners across Oregon, especially those counties that I mentioned. Additionally, I provide ongoing support, so I am in Lake County often. I generally spend time in both Christmas Valley and Lakeview, because that's where the Lake County Public Health folks are that I work with most. But really to support their efforts with outreach and enrollment, and engaging with groups like this to make sure that this program is on the map. A little history of our program: we began back in 2009 in the Office of Healthy Kids. So we administered the Healthy Kids program. As the ACA rolled out, we then took on the Navigator program that's mandated as a part of the Affordable Care Act. We were not responsible for the epic failure of the technology. You can't blame that on us for Cover Oregon, but in terms of the community outreach side, we've kind of overseen that from the very beginning. More recently, the Soisano program, and then the next iteration of that as the SB 558 program, also fall within our office, and we handle that community outreach and engagement for those populations. Okay, so circling back to what we were just talking about with the Early Learning Hub. So at this point, fast forward from 2009, this is our 10th anniversary of this program's existence. We now have amassed a really thorough network of about 350 organizations. As I mentioned earlier, the majority of them are volunteer organizations, and then only 27 are grant funded. And when we talk about grant funded, we're talking about small grants. I think this year, Lake County received a $75,000 grant to do this work. And those organizations, those 350 organizations, employ about 1,200 application assisters. So an application assister is someone like Michaela, and then there's also Lily George in Christmas Valley, and Ariana Asmar here in Lakeview, who are certified and trained to be able to walk people through the application process for OHP, and they have direct access to the state system. So oftentimes, someone might sit down with them and 15 minutes later walk out with OHP, fully active and then ready to go to the doctor or receive any other services. It could be vaccines, dental, preventative care, emergency care, any of those things. So it's a pretty robust access that they have to the system. Subsequently, we also have a specialty network of SB 558 organizations, which again is the Cover All Kids program, focusing on undocumented youth across Oregon. And then in terms of support, for the population in general, we typically, again, see the most hard to reach and disconnected folks, and so they may be the ones with really complex case situations. These are the folks who maybe have been those who have fallen through the cracks in the system, either at a local or statewide level, and need extra support. And so we have a variety of mechanisms to be able to do that, both one-on-one in person, or if it's something that Michaela or her other, colleagues there in Lake County can't handle, they always have direct access to me, and then, backroom access to be able to get things resolved nearly instantaneously in many ways, in many instances. And so it's really a pretty great tool to have in our back pocket to make sure that there is never a barrier that can't be overcome quickly, especially in critical case situations or instances where urgent care is needed. Moving on, Senate Bill 558, we touched on this. It again extended OHP eligibility to those under 19 so that immigration status is no longer a factor. Additionally, we also stood up a work group comprised of culturally specific organizations and stakeholders from across the state to make sure that OHP does a better job at reaching those communities and meeting the unique needs that they have. And most recently this year, we have also increased our grant funding to include information around the Reproductive Health Equity Act that was passed in the fall of 2017 and went into effect 2018 that expanded, the main thing that we see is that expanded coverage for pregnant women who might not have immigration status to make sure that those kids and moms are getting the postpartum care that they need, as well as other preventative reproductive health. So that brings us to Lake County, and so hopefully you have a better understanding, or at least a peek as to the breadth of this program and the depth and kind of the broad scope that we have to hopefully make OHP better than what it was, but more accessible. So where are we going now, and what does that mean for Lake County? And that's where I really hope we can appeal to this group to come up with some really great collaboration. Because we have now so many assisters and organizations, every single county is represented. What we're hearing, and when we get feedback from Michaela or Ariana or Lily about their interactions, is they might sit down with someone and take care of their OHP in 15 minutes, but then they might spend another 15 or 30 minutes resourcing them with a variety of other resources and information to really support their social determinants of health. So it might mean that they need help with accessing energy assistance or transportation, or hey, do you know of any daycares that have openings, or early learning centers, or summer meals and nutrition. Because that trust and relationship is built and they're already sitting there in front of Michaela, she has the opportunity to resource them with all of these other things. And so we want to do a better job at leveraging those interactions to achieve healthier individuals, but also a lot of these critical BCO incentive measures and CLINs that you guys work really hard and strategize to meet. And so if these are the people who are least engaged, they're healthier, how can we as a state and also as a community better resource the assisters to be able to maximize that time?
Maria,
Similarly,
question?
we are doing that as a state. Oh, yep, go ahead.
Question, Maria, Paul McGinnis. Are you using a universal screening application process to initiate the conversation on social determinants of health?
Great question. It depends on the organization that the assister is with. So for instance, I have assisters who are with organizations who have access to those assessment tools, whether it be housing or the all-encompassing tool that you mentioned, and it's an acronym that I'm not going to be able to roll off of the tip of my tongue. Paul, maybe you can fill it in there. So it really depends on if that organization already is tapped into that resource. We as a program do not have centralized access.
So it's more of a qualitative statement, and then the person that you're assisting has to come up with what their issue is. So otherwise, how's it going? Well, I'm hungry a lot,
Yeah.
I can't pay my rent, and then you go from there, right?
Historically, that is how it's been,
Okay.
and that's a problem, because there's inconsistencies, and it's just whatever they're cobbling together. So as a state, what we're doing is we are, especially for our grant, we have our open RFQ right now, and our new grantees will be awarded, again, starting July 1st for the next fiscal year. But as a part of that program, we are making sure that at least one, if not more than one, assessor per organization goes through CHW certification. And CHW certification has a lot of different meanings. I'm not implying that we are wanting assessors to go do home health. However, within the CHW umbrella, there is room, and many CCOs, EOCCO is one, and Paul, I would love for you to speak to this, but there is reimbursable funding available for health system navigation and case management education. And this is a perfect example of encounters that would really benefit from that type of training, and also help offset some of the expense of those folks engaging in those conversations. EOCCO was the first in the state to really take the lead on that type of interaction. And Paul, I'm sure you can speak to more closely, that there was a very robust pilot program in partnership with, I believe it was OSU and HRSA. Is that correct, Paul? The
Well,
piloted
I don't know about HRSA, but Oregon State University is we contract with them to do the education and continuing education.
We have that training here.
Yeah.
Yeah.
We've had a couple, but we heard that that might be held up for a bit. Do we have any news on the availability of additional community health worker training?
Why did it get held up?
I don't know.
They're trying to hire someone, I believe.
Yeah,
To head up the program?
Yeah,
So-
I can look into
Oh,
it.
at School of Public Health?
Yeah, so
Okay. Yeah, the other thing, Marie, just so people are aware, yes, the Eastern Oregon Coordinated Care Organization was the first to do a reimbursable expense for a community health worker, but they must be employed by someone you have a contract with. So it's not that these partner organizations, if they have a community health worker in there, we don't have a contract with them. We do with public health.
that's right,
So yours,
that's right.
a service that you provide would be reimbursable, but just be aware that, you get all these people trained doesn't mean that they have a way to get paid.
We have community health workers like at the clinics, like in Ontario and Baker City.
But hospital, community mental health program, public health, clinics, that's basically who we have contracts.
And we have those.
Yeah, anyone
all
that's
in
a
the
current
location.
Medicaid provider. So nonprofit organizations would not be eligible to bill for those. But in Lake County, because the contract with our program is with a Medicaid billable provider, it would fall under that. So we can talk more about that, but I want to be mindful of time. That's just an example of what the state is doing to try and support that. And then again, at a local level, there's all kind of innovation that could happen. And then secondarily, and we kind of touched on this, is we want to also be in better alignment with OHA as a whole. So OHA oversees so many other programs besides just OHP that have impact on social determinants of health, like reproductive health, HPE, public health, all of these other things. And so we want to make sure that these assisters, because they are meeting with folks that may often have intersection with multiple programs, that we're aligning our program and training our assisters to make sure that they at least have high-level knowledge of those programs and are properly resourced to be able to speak to them. So really going into this next biennium, we're pivoting a little bit from saying, okay, we want to expand and really focus just on OHP enrollment and application assistance to say, our assisters are doing a pretty good job of that. I mean, you're now looking at Michaela, a local expert who's been doing this for over 5 years. And Michaela, how many folks do you help annually just with like county public health? Is it like 500 people a year or something?
Math isn't my strong suit, but I figured it out before I came that it's 32 people a month. So, by 12.
Okay.
Mm-hmm.
So she's helping 32 people a month with.
Oh, sorry, Maria, that's
OHP
32 applications. So that could potentially have, a household of 6 members, or it could be an individual. So, sorry, 32. Sorry, you're good.
So for Lake County opportunities, I think, and what I would like to present to this group, not to solve all today, but to start a conversation as you do move forward with your CHIP and CHA and future collaborative opportunities, is to make sure that these assisters in this program is on your radar as another tool in your tool belt to help you meet these CCO incentive measures, to achieve the goals in your community health assessment and improvement plan. That I think it's pretty critical to have, a Michaela or someone else from that team a part of these discussions so that they can say, if you're talking about strategizing, they can say, oh, I can help with that, or, be another resource. And then also, as we look, Lake County still has a higher than state average percentage of uninsured OHP eligible individuals and families. And so looking at untapped opportunities, public health is obviously one avenue, but there's also the emergency room, mental behavioral health clinics, school outreach, and other summer programs that we perhaps could create more robust partnerships. As an example, in school districts across the state right now, we are launching what's called a 100% campaign, with the goal that as of now, with the expansion of OHP, 100% of children in Oregon are eligible for some type of health insurance, whether that be OHP, marketplace insurance, or private health insurance through an employer or an individual. So partnering with schools and these assisters to say, how can we be making sure that we're interacting with every OHP family and or those that are uninsured to at least make sure they're having the opportunity to apply for it or some other type of insurance and understanding the benefits. So that 100% campaign, I think, could be a really fun collaboration and effective collaboration in Lake County if that is something you were interested in. So that is kind of the entirety of what I wanted to talk about today, and I know it probably opens lots of conversation doors and furthering questions. So I don't know how much time is available today, but know that Michaela is a local expert, and I am always 100% available to support and nurture and strategize and help stand up some of these collaborations and strategies for Lake County to support the amazing work that you guys are doing. So. Arvinder, I'll let you speak to, time and whether or not we have time for Q&A or whether that's another conversation for another day, but hopefully it was helpful.
We definitely have time for any questions or comments, if anybody has any.
I have lots of them now. I'm taking some great opportunities from public health standpoint. So Maria, I'll probably this is Susan, sorry. I'll get probably either by email or by phone a hold of you. I had a couple of other questions about like presumptive eligibility and some other things from the hospital side as I'm seeing things coming through the ER. So I want to get with you on that offline to kind of find out what our options are there. But I think if we could find a way to have public health bill for those community health worker services while they're signing up OHP partners and gathering some of that, I don't know how we're going to get the codes on the claim to count for all of the screenings that we need to do, but they definitely have the opportunity to make those conversations and those connections.
So Marie, this is Charlie. I got a question for you. How is it that Lake County has such a high percentage of eligible but not enrolled OHP members?
I got this, Maria. A lot of them, like in Lake County, are just not people who want to be necessarily found. Like people who live in the middle of nowhere. They don't want to see doctors, so they don't feel like they need health insurance. They only come if it's an emergency. Or we have a lot of people who live in our little rural counties that came here to kind of get away from other people. And no matter if I go to Christmas Valley and do outreach there in Fort Rock, they don't want coverage or don't feel like they utilize it. And I think that's where I keep running into this kind of, I feel like, old school mindset that, if you don't need it, you're not using it, you don't need it. And that's where I keep running into kind of that theory with people. And I think that
I think what
you're good. Go ahead.
I think what Michaela is saying is absolutely valid. I would say additionally, typically in rural areas, especially not specific to just lakes, but in Eastern Oregon, there is also some stigma around OHP, so anything we can do to reduce that stigma. And then also recognizing that right now, Lake County Public Health is, and then in Christmas Valley, we do have Lehigh Community Health Clinic. Those are the only two active sister partners right now, which I don't know that it's necessarily that Lake County needs more. It's just that there are also, again, people who may not intersect with public health. It may be that they get services elsewhere, and that's not someplace they're going to go for services. And so circling back to that question about the early learning hub, that's where I think we can, myself, Michaela, as a community, really emphasize beefing up some of those relationships where low income or OHP eligible folks might be frequenting aside from public health, so that we can meet them where they are and create strong referral networks and or maybe some additional off-site opportunities to enroll in OHP aside from having to go to Lake County Public Health or the public health office in Christmas Valley. And so brainstorming for ways to get Michaela and Ariana from time to time in the community in different areas.
Well, Outback Strong is attempting to deal with that mentality, and so maybe during the next year or so, just one tiny campaign around accessing the benefits that you're eligible for would be helpful, right?
Yes.
Because what you described is what Christie and the Outback Strong people are trying to come over.
One other thing that we heard too is that another reason why people are choosing not to engage with healthcare or become insured is a fear of the system, either because they think that when they go to the doctor they might receive a scary diagnosis, or there's been a broken trust with healthcare providers in the past, and so there is a fear associated with what's going to happen when I go to the doctor. Which again could fall into stigma and all of those other things. But that would be the other top reason that has been documented for why folks might choose not to enroll.
I think that awareness sometimes can be part of that problem as well. I know we've had Michaela in this role for 5 years, but we still, from the time when I was in the clinic, and we would say, okay, yeah, Michaela's up at Public Health. We're happy to, give them a call and let her know that you're on your way up there to talk about potentially being eligible to sign up for OHP. And we lose them in transit. We lose them from the time they were at the clinic to the time that they get to her. And they're truly like, oh my gosh, really? There's somebody here locally that I can go talk to. They still, after 5 years, aren't aware of that. And so I know it's a grant-funded program, but maybe a little bit of either social media attention, or maybe we can get it on Outback Strong or something of that nature to help let people know that it's out there. But then we also do lose people. It's like, okay, I'm here at the doctor, I'm getting done what I have to get done, and I'm still afraid to go. Maybe they're going to tell me no, or whatever reason it is that they may not want to go sign up. We definitely lose them in that transit.
Maybe we have them here.
I think
And
it's
Michaela
also
sign them up here.
undocumented.
That would be I'm totally willing to do that. We could, Lakeview's not huge. You could call me and we could, if there was an office somewhere, I could run down here and meet them here on their time. We also could, set up days where we're here on Wednesdays or something, and we're here to do that. Welcome for anything. I think that's why this is here, to create those connections where we can be more of service and catching those people where we don't see them in our everyday practices.
Unless you have kiddos who don't go to public health, you don't know, for the most part. That's kind of what we experience, but having somebody on campus a couple times a month might be beneficial.
Did you have a comment?
My thought was that in that percentage of the 400 or so that are not insured, some might be undocumented, and therefore their children qualify for the health care, but they don't. So they would be hesitant to apply for insurance or wouldn't qualify because of their status.
Yep, and in recent years, with the new administration, that has been more of a thing, with fearful of being found out if they're even applying for services, and that goes back to the government. And we have done a lot to kind of combat that stigma also. But the good news is even undocumented people can at least get CAWM coverage, which is
Get
not
what?
everyday CAWM. It is only emergency coverage. So if something dire were to happen and they came to the emergency room, that would be a covered service, but it's not going to cover their everyday appointments or things like that. But at least they're eligible for
With the
something.
exception of pregnant women.
Yes, thank you. With the exception of pregnant women, and then all undocumented children under 19 are eligible for full coverage, full benefits.
Do you find most undocumented understand that, know that, or?
I think that it has gotten a lot better recently now that we have a Hispanic person in our office and she's very trusted in the community, that she's done a really good job of putting that out there that, you know, you're not going to be found out, your children can have full coverage, you can at least have emergency coverage. And we've done a lot more outreach to that specific population to where I think that we have done a good job kind of combating that and putting that information out there.
Well, we still have 400 people in a county of 23, or 8,300, we have a long way to go.
Right.
We've got to do something more aggressively to find people that need the care that they're not getting. Because they're.
Yeah, I think, it's one of the biggest challenges in every county across Oregon is identifying those people, right? And one untapped, and I'm not sure if we have school district representation in the room there, but
We do.
one of the things we're working on as a part of the 100% campaign is adding a box to the registration cards for school registration that would be optional, but would ask, do you have health insurance? And being able to identify those families, even if the school district doesn't share that information with any other agency, but can identify through, whether it be school nurses or public health or whoever, be able to just have a conversation with that family. It can really help identify, is it just personal choice? Is it a fear issue? Is it a stigma issue? Is it a concern for immigration? What have you? And so that's one thing that other school districts in the state are looking at trying this fall, is to see if we can start generating some data on who those families might be.
I think that's a separate conversation with us, and especially my registrar, who handles all the registration too. So I'd be happy to entertain that if we could set up a time to talk or whatever.
Do you think
Did
that's
you
a
hear me?
reasonable, Will, do you think that's a reasonable idea? Or
I think
is
it's a
that-
reasonable idea, yeah, but once again, we need to run through my registrar, and I need to check policy and everything to make sure. Jack, do you have any thoughts on that?
No, I don't, it's never been done before, but that doesn't mean it can't.
Yeah.
The thing we've tried previously that hasn't worked really well is like during school registration, we've come down and had like a table, and we didn't necessarily ask anyone to sit down and apply there because of the stigma and that kind of thing. You don't want to be identified as low income, but just the information that we can provide the service is where you can find us.
Yeah.
You can take away a paper packet, and it just wasn't super successful. So I think another idea is whatever
When
would work.
Kayla,
Yeah.
you want to come and meet Monish, you guys and I, and discuss it or
Yeah.
talk about it? Okay.
That would be great.
Why don't we do that?
Well, and even if we were able to have Michaela or Ariana, maybe a couple times a month, it's like every other Wednesday is OHP sign-up day or whatever. Our location is a lot easier at the district on campus than, saying, oh yeah, you have to figure out where public health is. And we think, because we all are in healthcare, we know where public health is because we, it's part of what we do. But it's one of those things like we don't see the sign that somebody else sees because we're blind to it, And I think that being in a more open location that's easier to access might help also.
Yeah, I agree.
And Paul,
Let me
if
look at
I,
my calendar and I'll set something up with you.
Okay, perfect.
Okay.
if I remember correctly, Summer said she gets a list of all the people, like her county, who is OHP eligible and who may not be receiving services. I don't know if that list.
That's if they're signed up though.
If they're signed up
Yeah.
and not.
These are the non-signed up people that we gotta find.
All right.
I don't know how we know about them, but,
Yeah,
I mean, if they haven't signed up with anything.
yeah, how do we know they're a number?
So there's this 400 people that, my name is Bob and I don't sign up with anything.
So there's, just based on the estimates that we had in the assessment, Charlie, there are about 680 uninsured people in Lake County. So if they have 400 that were eligible, the other 280 are people who choose not to use the exchange.
They're the ones that if we want to find where there is a problem, could be, may not be, maybe it's perfectly healthy, but they might be in dire need of some help there.
I think one of the other things that we need to do is talk with our patient financial services staff in that we often offer different payment opportunities and things of that nature, but we need to maybe be providing that information that, raising that awareness that we do have, a site here in Lakeview where you can go in face-to-face and sign up. And I don't know that that we've taken that opportunity in the past. So maybe that's something that I can talk to my ladies about to make sure that they are definitely offering that information or, whatever. We can maybe work more closely on raising awareness that you definitely can get coverage here locally.
Yeah, that'd be great.
Yeah, I mean, getting coverage and engaging all at the same time is, kind of the goal is setting that standard and, as it gets tricky, but there's so many different models and I want to be mindful again of time, but know that I am happy to engage in further conversations with organizations specifically, or in smaller groups to be able to brainstorm, and I can share some best practices from other rural areas that maybe have worked or haven't worked, so that way we can find strategies that work specific for Lake County and the many different unique communities within the county. So know that I'm making myself 100% available, as is Michaela, as one of our sisters and her colleagues. So hopefully this is just the start of a really great conversation, and I think there's just so much opportunity that we can really achieve some really cool things.
Okay. I think next we have Estella with an OHA update. Thank you, Maria.
Okay,
Thank you, and I apologize, I'm going to have to bow out, but I appreciate all of you, and I'll follow up.
Thank you.
thank you.
Thank you.
I just wanted to, this is a 7-page document, and I believe our vendor was going to send it to you electronically, but we're trying to open it now. First of all, I want to let you know that the Transformation Center is, they're a branch under the Oregon Health Authority, and their goal is to provide training, provide webinars regarding health issues, ways to improve the metrics, and so I wanted to start off that first. The Oregon Health Authority Policy Board is looking for two committee members to fill 2 spots, and they're looking from areas from Central Oregon, the coast, and Eastern Oregon. And this committee is to coordinate and develop a policy that promotes health, the elimination of health disparities and achievement of health equity. And so in this email that will be forwarded, the deadline to complete this is May 31st, and I hope that some of you will consider participating or becoming a member of this committee. It's just very important that we have Eastern Oregon representation. This way it's not all on the west side making decisions, making recommendations for us here in Eastern Oregon. So that's why it's very important to look at this opportunity. And also in June, we talked about the Innovation Cafe, and I understand that, oh, there it is. So go down a little further, please. And we're talking about the Innovation Cafe that will be held in Portland the first week in June. And
Is this the one?
yeah, oh yeah, I just went over that one, so just go down. I'm now to number, the bottom one, of Innovation Cafe. There,
Yeah.
thank you. We're there. This Innovation Cafe, it's the main focus is social determinants of health. However, registration is full, but there's a wait list if you're interested in participating in the electronic. You can still register, but it's on the wait list. And my understanding of when people are on the wait list, there's some people that at the last minute can't attend, and if your name's there, you'll be considered, there's no fee to attend, just your travel expenses to Portland. And I'm glad our vendor is going from Lake County. And I'm sorry I won't be there, but I hope that other Eastern Oregon representation from our 12 counties will be there. Caller, you go. No.
No, but I think Union County is presenting their warming shelter there,
nice.
so there's people, other people will.
Yeah, and this is a time to share innovation, to share what's happening in the various counties and in our community advisory councils.
So if you budgeted some travel for, out of the administrative funds, when we do that in September, you know, the money that just supports the CAC coordinator and that kind of stuff, usually the travel associated with that is one of two events, the CAC statewide event, where CAC members go, or this Innovation Cafe. Those are the two annual events that you may have budgeted travel for. I can't remember here
I don't
specifically,
think we did.
but other people have.
We'll look, yeah.
Do you know if we did or not?
No, I'll look into it and let you know.
And I'm going to talk about, this is for clinic information and also for doctors, because doctors give the CMEs. This is continuing medical education, controlling high blood pressure. This is a webinar that's something that is going to be available September 20th, but they like to give you as much advance notice as they possibly can if anyone's interested in this topic.
Yeah.
And I'm not going to hit every point, just things that might be of interest to you, and you're welcome to look at this as your leisure. There's a funding opportunity on community feedback on maternal, child, and adolescent health needs. This is a small grant. I believe it's like 7,000.
Yeah, that's what it was.
Yeah, 7,000.
And 75 pages to fill out. Just not worth it.
I'm sorry, this is the way it kind of rolls with state government.
We're not doing
Not for $7,000. I said, you need 3 more zeros.
Yeah, so, but if you're interested in submitting a proposal, May 13th.
Okey dokey.
There you go.
With a
Right
short
around the
period of
corner.
time. That's it.
Yeah.
This one you might be interested in. Let's go to L. It says sustainable relationships for community health.
They actually had a meeting on that here this week.
Oh, that they were going here in Lake County?
Yes.
Oh, that they might be interested in applying, because there's going to be 3 grants, not to exceed $120,000 each, starting July 1st, if you're accepted, through June 30th. And this has to do with chronic diseases and also associated risk factors like tobacco, physical activity, poor nutrition, alcohol misuse. So I'm glad that Lake County.
Yeah, related to, specifically here, it's kind of a supplement to the Living Well with Chronic Illness, Chronic Pain programs is what I believe what Christie was targeting for that.
And then we'll go to
Jamie,
Emma.
did you get involved with that at all?
No, we brought it here originally, years, like over a decade ago, but I haven't been involved with it
Since?
No.
Did we have good success when you did that? before?
We trained everyone that we could the first time, and then since it required the program is evidence-based, and it required a minimum number, and we couldn't reach it again. So we didn't have success offering it another time.
And the next one is F, federal grant opportunity, primary prevention of abuse and neglect. The additional information is there to develop integrated family support systems and continue community-based services to support families and help improve the child welfare system. And as many of you know, we've been in the news, Oregon has been in the news because children going out of state with complex needs, and state of Oregon, Department of Health and Welfare, or Department of, Child Welfare, they failed to review how those children were doing, which is very sad. When I read that story, it just hurt my heart because of the poor children out there, who knows where, and we're not checking on them.
Idaho, that's where.
They went to Idaho.
That's where to go out of state.
Oh, I think there was one that went to Illinois.
Oh,
Yeah, so.
well, that's a lack of foster homes in Oregon. That drives that. But they did reverse one in Gillum County. They put the parents in a hotel and let the kids stay home, rather than take the kids from the family environment, which I thought was pretty neat.
Does it work out?
Well, they had a relative that would
Yeah.
stay there.
Like
so that-
grandma or
Yeah,
something
so that
like
the
that.
kids' routine's not
Are you
messed
sure
up.
the parents
Yeah.
didn't go into JAIL?
No, that was a separate,
I don't know if there's a hotel.
That was after the hotel.
yeah.
Just wondering.
In Lake County, usually the jail come first, and then the hotel.
I think that's a novel idea, keep the children in their school, keep the children in their community, in their home. Yeah, I think the parents should leave, but that's just me, because I have a heart for children. Okay, moving right along, there's, as you have heard, there's a lot of information on Campaign on Pain. We have Eastern Oregon, CCO has pain schools, but they're going to be doing more of a campaign later on this day, later on in the future. But there's a webinar on June 18th if you're interested. So all of this information, for the most part, is no cost to you, and it's just information that will hopefully improve your knowledge and have opportunities to ask questions and contact individuals of who they are is also located on this page. So are there any questions? Thank you.
Thank you, Estella.
Hey, what, Susan, may I go?
Yes.
Yeah, while we're on the Oregon Health Authority, and Estella mentioned the Oregon Health Policy Board looking for people for their equity committee. We didn't meet in April, but the Oregon Health Policy Board held its meeting here in Lakeview. So the whole group came over on April 1st and 2nd, and I wanted to recognize the organizing ability of Charlie. Pulled in community leaders for discussions in the afternoon before they held their actual meeting the next morning. We had both these rooms just full of people providing input to that group, and we've heard positive things back from the members that attended. Yeah.
Good.
And even if I was on the phone, I wasn't able to join in person, but thank you.
Could you hear?
Charlie. Yes, I could hear.
We didn't know that you were there
Oh, yes.
during the meeting.
Oh, yes, I was on the phone.
I knew you were going to be, but
Oh, I'm sorry. I think I don't know what happened, but.
Well, they kind of only looked for board members. It was like they were asking if Dr. McKelvey from Coos Bay was on. They called a couple
Oh,
of
yeah,
names,
that's right. The roll call.
They didn't do
Yeah,
anybody else listening in, and, public
No,
members or something
that's
like that.
right.
So I didn't know you were on either, so
Yeah.
I saw you after.
Yeah,
Anyway,
and I heard it.
thank you,
Because we
Charlie.
were trying to split the board up.
And
It's
community
usually
to
the roll
host.
calls on the board.
I think it's a good opportunity anytime we have to help people in Portland understand remote Oregon issues. And I think one of the very helpful things was those that drove from Lapine here got to realize a little bit more how big the county is. Those that came from Medford, it wasn't quite as impressive. But, it doesn't feel that far from Blythe. I don't know.
No, it's true. I mean, if you come down from the valley or something, from Eugene, Salem area, and you make it to Lapine, and then you're thinking, well, now I'll just hop the rest of the way down to Lakeview. Well, Lapine's halfway, barely. You still have another 100 miles to go, more. Yeah.
140.
Yeah.
141 to the hospital.
Okay. He knows, he makes the drive.
And good news was no one hit a deer, cow, or drove over the speed limit.
And thank you also for giving them a tour, the new tour.
Yeah, Brooke did good with her students over there with them.
Seemed to be pretty happy.
Yeah, that group has gone downhill since then. They put on their best faces for all of them. And then now I'm like, what happened? You guys were angels that day.
Yeah.
And now they're,
Well, it's spring fever.
is hit,
yeah.
yes.
You can tell just by looking at Will that the school year's coming.
Yeah, they're ready for summer.
Okay, Arvinder, are you ready with chip updates?
Yes, thank you, Susan. So the first update is about the community eligibility provisions, the CEP program. So in March or February, during the March meeting, I had told you guys about that CEP program. I'll give you a quick breakdown. So So there's an opportunity that if the schools, our school district are eligible, there's a criteria. If they're eligible for that, all the lunches are for free. So in February, March, thanks to Brooke, we found out about this opportunity, and then working with the schools, we were trying to find out if there was a way we could opt in. So I have some good updates on that. So our new AmeriCorps Vista person has been working on this. So we got in touch with a contact with a person at the ODE. She is the child nutrition specialist, and she's in charge. So she helped us a lot. So we told her that, so initially the issue was that the numbers our school district had were different from the state numbers that they had. Or at least that's what we thought when we saw the numbers online. So we got in touch. We have been in communication with this contact, and so the person said to us that for our schools to opt in for the CEP program, the schools need to participate in a national school lunch program or school breakfast program. And we informed them that we already do that. We already have in our school district the reduced or free lunches program. So we do already, and there's a percentage that if you are above 40% is when you're eligible for the CEP program. And our numbers show that all our schools are above 40%. So we had more conversations with the contact, and so the ODE contact told us that probably the school district 7 is participating under a different name in the school nutrition program. However, she said that the school district will need to elect. So we need a person from the school district who works with the child nutrition program at the school. That person will need to elect the school district to participate in the CEP, and as part of the renewal process. And we got good news from a contact at the ODE that even they said that all our schools under school district 7 do qualify for the CEP.
Is it really only 40% for everybody to get a free lunch?
It's free breakfast and free lunch too.
Right?
Yeah.
So if 40% were eligible for free, then everybody's eligible for everything.
Yes.
Really, 40%.
Yes.
So does that mean it's gonna happen?
As long as the opt-in was early April, but they've extended, right? Or they said that we can still opt in.
So first they told us that early April was the deadline. Then they said that no, early May, you have time. So right now, all they have said is if somebody from the school district just contacts, and we have that contact information of that person.
Have you talked to Janet Nelson? She's in charge of our nutrition and lunch program.
Yeah, so actually a couple of weeks back we sent out an email to, and we have also CC'd you on it there, to Susan Warner, Janet Nelson. Yeah, so we have informed you, and I guess now the only step is that the school has to contact this person, and on paper we are eligible, just to, I guess, just sign off on the documents, and then we can opt in for the program.
Is this like the summer school lunch program?
I think it's for year-round, all lunches.
During the school year.
Okay.
Is it annually we have to renew, or is it for?
I think it'll be 4 years.
It's a 4-year contract, and then if you go below the 40%, after the 4 years, they give you like a 1 year in between. So if you had to go back to your old system,
They'll give you a grace year to give you a chance to get your numbers back, and if that should happen.
but everybody I've talked to at the school, they've seen the numbers rising. So the trend doesn't look like we would go back under 40%.
But in the years I've been in this district, it's just gone up dramatically.
So I think
That's
it's
awesome.
a really great
That is
opportunity.
amazing that you were able to locate that program, and great work, everybody working together. I know we talked about it over the last year. So seeing that it's kind of come to fruition is amazing for our kiddos and for our families in Lake County.
Yeah, our data state, according to the Department of Education, it was 43.6% across the whole town were eligible.
Yeah.
47% in order.
And for those families on the cusp, I feel like that's,
It's a big deal.
yeah, it is.
It is. Maybe free reduced percentage of Fremont A is 58%.
Yeah.
The
Yeah.
schools like Plush and Adel, they're not eligible though because they're not part of the National School Lunch Program.
However, the North Lake School is also eligible. Yeah. So yeah, somebody from the school district just needs to elect to participate in the CP, and as always,
I'll get in
we'll
contact.
assist you.
I'll get in contact again now.
Yeah. Next update was about the Living Well classes. So we have several Living Well classes that we conduct. We have chronic conditions, chronic pain, and diabetes. So our first round of Living Well classes completed in February. That was a chronic conditions class. We have a new session, that's a Living Well with chronic pain, that is in motion right now. We conduct that at the senior center. And also we have a diabetes support group, which has been going really well. We started that on April 1st, and we do it once every 3 weeks. The next class will be on Monday next week. Next update, we are in the interviewing process. CHIP department is interviewing for a new position for the food co-service member this year. So we'll be done with interviewing in the month of May, and we're also interviewing for positions for the summer lunch program. And just to remind you, summer lunch program will kick off on June 10. So pretty soon. Next update I had was about, again in March, I had sent out a survey to the council about the community health plan. So on the survey there were 2 questions, and I have the results now. I just wanted to share that with you. So the questions was for Lake County or LCAC to choose 1 or 2 priority areas in its community health plan, which matches the Oregon State Health Improvement Plan. So the 2 priorities that got maximum votes to be included in the EOCCO CHP, the maximum votes was gotten by alcohol and substance use, and the second priority was obesity. For the second question was to, the Oregon Health Authority wanted to also have some additional items for the latest version of the State Health Improvement Plan. So two priority areas that LCAC feels are the most important. The first one was, and this is a mouthful, adverse childhood and life experiences, toxic stress and trauma. And the second place is a tie. I got equal votes for safe, affordable housing and food insecurity. And again, Lake County will be having its own community health plan or a strategic plan, which we are due by June 30th. So I'm working on that, and for the next CHIP meeting, which will be on June 13th, I'm going to ask the council to vote upon the community health plan. And we can again decide if we want to go with safe, affordable housing or food insecurity. Can we have 3 priorities?
You can have 10.
Okay.
You know, and actually, even if you're just on the periphery for housing,
yeah,
it's good to have it in your community health plan at the local level, because if there are applications for the Office of Community Development and Housing, and you have it in your CHIP plan, you get extra points on an application.
Do you have any updates on if EOCC is going to have some grant funding for housing plans?
Well, we're told that we have to have housing in our regional CHIP plan.
Yeah.
We don't know until this year when they write rules for the contract. We don't know, first of all, whether we have the contract or not, but it looks real good.
Yeah.
Whether they're just going to say a percentage of your revenues, which means you have to earn money when we're also at a risk for a loss, or if they say a percentage of the global budget we give you is going to be dedicated towards social determinants of health and housing.
Yeah.
So that's a big difference. If it's 3% of revenues versus 3% of all the dollars that we get, there's a difference. But there'll probably be something around expanding supportive housing.
Okay.
Yeah, the quality pool dollars for Eastern Oregon CCO was $12,206,254.
Right. By the way, we got all of that. We're getting all of it back. We met 13 or 17 measures, some by the skin of our teeth.
Awesome.
It could be more than that 12 million if other CCOs didn't make it, because if they lost money, it goes into a pool and distributed to the people who did make it. But that quality pool in for dollars is a whole separate issue than using core funds for social determinants of health. And just so you have an idea, if they said you must spend 1% of your global budget, you know, that would be about 3.9 million for the CCO, because we're about a $390 million organization.
So then some of your other programs, like the quality measure
That's all
incentives,
separate.
would those items take a hit potentially to help offset the cost of?
No, I
Back,
think,
or is it will it stay separate?
our board has always dedicated every penny that's come back, which is really what's made the difference between our CCO and others. All those dollars are reinvested, whether it's patient-centered primary care home payments, quality pool payments for the providers, the dollars that go to the LCACs, the opt-in programs, the new grants program, Arcadia, technology, you know, the EDDI, pre-manage, all of that stuff comes out of that money that we earn back by needing measures.
And that doesn't happen with all the CCOs. We go back and reinvest in our counties and communities and community advisory councils, but that doesn't happen in all. Not
So
many.
the money the CCO gets back, though, it's not just dependent on whether or not you meet those measures,
Oh,
it's
it
also dependent on whether other CCOs make theirs as well?
Yes.
So if
Because-
they
so
don't make
if
theirs,
we-
the
if
pot
we-
of money is bigger, and
Yeah,
if they do make all their measures, the pot of money is smaller,
Well,
basically depending on.
Yeah, the pot of money that we put at risk was 12 point, what was it, 3?
260,000.
Okay, 12.2, right? If we only got 12 of the measures, we would only got 80% of that
Right.
money.
Yeah.
We got 13 to 17, so we get 100% of that money.
Mhm.
But if another CCO only got 12, and there's 12, you know, that
Yeah.
20% goes into another pool, you know, and it collects
Yeah.
up, and then there's a distribution of all those dollars back to the CCOs that
Mhm.
made the measures.
Yeah. Interesting.
That's really great. I have seen from the clinical side, going through a couple years of those quality measures, and the clinical employees, they see how that comes back to their community and how their patients are getting healthier because they're looking at preventative health. And at first it was, I have to ask 52 questions to every patient that comes in, and it was like this huge overwhelming concept for them. And so like we started small, but we made huge progress in that area, and they can really see how that's impacted the community that they live in. So.
The final numbers are in for the CCO though. And just because I know Charlie would get graded by this, Harney County met all of the claims-based measures. They're the only county that had a green bar in the data that you look at.
That's for 2018.
Yes.
When will those numbers come out, or have they already?
They already have it.
They're all set.
Yeah. I sent them to you. The finals?
Yeah, could you send them to me too? I haven't seen them.
Okay. They're just the claims-based ones, and then
Oh.
the other ones get from Sarah and Courtney.
Oh, okay.
Yeah. Farming County taking care of a few other things, they're in pretty good shape.
We all have our challenges.
Next I have,
At least that wasn't playing.
Nice. Go ahead.
next I have the Eastern Oregon Healthy Living Alliance update. John Adams, the director of EOLA, couldn't be here today, but he wanted me to share some updates. So EOLA right now is working on a Veggie RX expansion program, which will be active in 4 EOCCO counties. One of them is going to be Lake County. So again, Veggie RX is a program where if somebody is eligible for whatever criteria, they get these vouchers to purchase fruits and veggies. So some more information about the grant that they are working on. So the amount available for the grant is $500,000 over 3 years. It's under the Gus Schumacher Nutrition Incentive Program. So the plan is that EOLA will administer the program and partner with clinics in each county, which will prescribe vouchers for patients who meet not yet determined diagnosis and are eligible for OHP and from low-income households. The vouchers can be spent on the same kinds of fruit and veggies eligible for the WIC program and similar federal programs. So as of right now, John and Karen Wheeler, who's from Gobi, they have been discussing the issue of this opportunity not being available to non-OHP members. So we'll hear something more about that, if we can go around that.
Well, actually, Arvinder, the way I first read it, it was only people who got SNAP benefits, but then somebody pointed out somewhere else where it said all Medicaid people were eligible. So not all Medicaid people have SNAP, Supplemental Nutrition Aid Program. So, but it will be limited to just that. So if you're screening people for food insecurity and they're on Medicare, they're not going to be eligible for it. The counties that run the Frontier Veggie RX program, which is what is run through Gobi, and the LCAC dollars are spent on it, Wheeler, Gillum, and Sherman are small enough that they can universally give the coupons. Harney, it's limited to just OHP members, and it's limited to people who answer mostly all the time, that you're going to be hungry, or because the screening tool, many times, the first two answers technically make you food insecure. If you only answer the first one, that's when they call you hunger, but the percentage of people that are hungry. So it's just hunger people in Harney that are eligible. That money can be eaten up pretty quick, I can tell you that. And then the other thing that you can think about is something called the Double Up Food Bucks program. I know it's linked to extension in some of our northeast counties, but it's people with SNAP benefits who go to a farmer's market and they can spend $10 on fruits and vegetables and then it's matched.
Yeah.
So even if we did that, I did the math for Harney and said if all 1,800 people went to 3 farmers markets, that's $40,000. So
$40,000?
Yeah.
Is that once per week?
Well, if they went 3, if you gave them one farmer's market a month for the 3 that it's there, and they all went and doubled up their bucks, it would cost about $40,000 a year. So anyway, I'll be associated with that and can keep you in the loop.
So with all the information you just told us, Paul, John had 2 questions he wanted to pose to the LCAC.
Okay.
So the first was if the LCAC was willing to write a letter of support for this project. And the second was if the Lake County clinics were willing to be involved, which will include a letter of support, but will also include some clinic processes, like the clinics would prescribe and will need to track some measurable outcomes. I think we don't have any clinic representative, so I can speak with the clinics and get an answer for that. Going back to LCAC willing to support this initiative.
I would suggest we first talk to the clinics.
Okay.
And then make a recommendation from there to whether the LCAC wants to support it.
The experience in those other counties, Arvinder, is that the clinics aren't the biggest prescribers.
Okay.
Who is?
The biggest subscribers tend to be public health, DHS, and early childhood providers, and the schools.
So maybe that's where we ought to ask and get information from prior as a recommendation.
I mean, there are some, the clinics do it, but they're not the ones who are really aggressively, screening the applicants and so forth.
Well, they're touching them at different times.
Yeah. Well, the ones that are going to be more eligible are going to those other programs, right?
Like in our case, possibly the diabetes support group, I could see them utilizing it.
You got a comment?
But schools will see kids that have greater needs. Public health might have people that, but if we have people that aren't showing up to public health, we're still not touching it.
Not touching everybody, but it sounds like it's the same, like, income levels and the same criteria to meet that program sourcing, some of them at least.
Yeah, I mean, we heard about that backpack program up in the north part of the county. I mean, probably all those kids would be eligible.
Right.
The problem there is, you know, what store is in Christmas Valley that has a nice variety of fruits and vegetables?
They don't have
You know, so the vendor would be up at La
There's
They have the farmer's market thing now, right?
Yeah, but it's all year long. I mean,
SIDS is all year long. I think they do.
Christie
Yeah.
just did a
But they
program
also
similar
have
to
is,
Veggie RX.
if they knew they were gonna get money,
Through the clinic.
Oh, yeah.
somebody would
there.
go and buy
So,
vegetables.
yeah, they
so
have like a.
Grass Valley Market and Huskies Market on 97 in Sherman have a greater variety of fruits and vegetables.
There's also a county that sets up their own farm market, their DHS twice a week, and they hire a person to be the Veggie RX. I don't think it was Sherman. I read about a lot of counties yesterday to get up to speed on this. And I think Christie's concern was, for some reason with this grant funding, that whoever, that this money would be earmarked for only OHP or SNAP recipients. So that brought to mind the question, who would be screening them? Would they be allowed to ask if they're on OHP? I certainly don't know, not, you know, being relatively new here, but Christie wanted to make sure that we had considered that.
Yeah, the answer is yes, you
Okay.
can screen.
Yeah,
And
that's
no.
helpful, thank you.
If it were part of our program, I mean, the Eastern Oregon CCO likes the program, got nice qualitative input, people are grateful, blah, 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 blah. But what's the health impact and what's the impact on the overall spend of the people that are part of it? We, you know, for Harney, we collect their Medicaid ID number and can look at diabetes, BMI, hypertension, and the overall spend of the people who are part of it. I mean, that's the only way we're going to get our board to expand the program beyond allowing the LCACs to use their funds to do what they want. And if they were going to invest in something on their own, it has to show a stronger return on investment.
It's got to link back to your quality measures.
Right, those
Your
three,
social
the
determinants of
BMI,
health.
the
You know,
hypertension,
that's not all
diabetes.
true, because let's say that you make it available to people that are not signed up with OHP.
Right, which is the program is designed to only have those two questions about food security, and so it's supposed to be available.
So if you ask the question about food security, and you get people that have not signed up for OHP, but they get a benefit, they may think there is value to signing up for OHP, and we get, the EOCCO benefit it gets is more people signed up for the OHP plan.
That's a good point.
Pardon me?
No, it's true, we would get their per member per month payment, depending on eligibility category.
That's right. And so you accomplish multiple things, because you're not putting, you're putting a carrot before the horse by encouraging people, by giving them a benefit, and saying, so, you know, if you did sign up, this could continue.
So just from the OSU Communities Reporter database, which I think used Feed America as its source, it's 1,310 people in Lake County screened positive for food insecurity.
1310, we have
Yeah.
8,300 people. That makes us 20%?
You want the percent? I think it's 17 something. 24.9%, no, 16.8%.
It's a high percentage of the population.
Well, it's 24.9% of children.
We're hoping for a more accurate census this year. I mean, we're just starting to get into that for the 2020 census. And that will help get a better.
Well, you think it's higher or lower?
I think we have a higher population.
Higher population or higher population of food insecurity?
Aren't you creative?
Well, I don't know, those are your numbers, I'm just talking the census and the number count of people in the county. It's hard, that's, That's all the census is going to do.
That's what we talked about it, and what you said.
And Paul, for the Frontier VGRX, it won't, like, if the clinics don't prescribe, then they get referrals from DHS and public health, but does the VGRX coordinator give the vouchers out to DHS so they have them?
Yes.
Yeah, okay, that's what I thought.
Yeah, they're distributed there.
That was the question.
And Rachel, just so you know,
Mhm.
Estelle, I appreciate your saying Frontier Veggie RX
Yes.
because there's a number of Veggie RX programs
Yes.
and they all have different rules.
Right.
So-
Then that's where I was
Make sure
trying
that
to
you're
get us.
differentiated because
Yes.
what they're doing up at the North Lake Clinic for the population with the LCAP dollars here, you know, it's specific children that are either undernourished or have a high BMI that are part of that program. You know, it's, the eligibility criteria are very different.
I was just gonna say, as an answer to John's question, I would imagine from the clinical standpoint, if those, the data would be a lot easier for them to collect if they knew there was gonna be payoff in their quality measures. So if there were, you know, the kiddos nutrition or things that are those targeted hard to meet measures might be a greater incentive for them to want to participate.
Yeah, this program, this GUS program, you can buy grains, things like that, and which our vendor mentioned, whatever a WIC recipient could buy,
Right.
which is much broader than just fruits and vegetables.
So I have another quick EOLA update. So the EOLA program coordinator, Alana Shamilak, will be leaving in June. So the position is open, and I just wanted to inform the council so you can pass on the word for that position. I think they haven't posted the position online yet, but as soon as they do, and I get the link, I'll also forward that to the council.
I think he just sent something out with a link.
Oh, he did?
I think
Yeah.
so.
Yeah, so that's all for the chip updates. Do you have any food co updates?
Another food access related thing. So I mentioned the Cooking Matters program, and you'd heard about it a lot. So we have a group we've been meeting, and Daphne just had to leave, but it's Daphne, Michelle Totten with DHS, and Sherry Swartz, who she went to culinary school. She's really engaged with 4-H. I think she's a vice president 4-H.
Yeah.
Something.
Yeah.
So, and we just reached out. We're talking to WIC with public health as well to try to get all sorts of partners together. And so we're going to host. It's going to be a 6-week program this summer, June 26th to July 31st, I believe. It's Wednesday nights, and it's going to be open to families of all income. It's aimed at school-age children and their parents, so that we're getting kids and adults cooking together. We're trying to make sure that it's especially open to people who maybe have received SNAP benefits and TANF and WIC. Well, WIC, I guess, not necessarily because they don't have school-age children. So in the process for that, if anybody at your clinics or, once we have more information, you can hand it out to people who you think might really benefit from it.
Where is it occurring?
So we are trying to talk to, we reached out to the school, the high school, and we're going to try to have it in their culinary classroom this summer. Yeah. So.
Will they eat a meal there that night?
Yes, it's not a full meal, so we decided on 6 different themes for each one, so some of them will be about how do you reduce sugar in your meals, or another one is having like a wide variety of fruits and vegetables. One will focus on whole grains, canned, fresh, frozen, the difference between those. So they'll eat something, yes,
Okay.
and we're planning on sending them home with like, here's what you can do this week, like making it something. And then also popped up in those conversations was, have you guys heard of Produce Connection? You were involved with Produce Connection, right, Dan?
Mhm.
So, that's through I want to say the food bank, food share, they all confuse me.
Food bank.
Food bank, so they send over fresh produce on Fridays throughout the summer. And Michelle Totten through DHS was kind of took that on a lot, and so we're hoping to relocate it to the summer lunch program on Fridays, so then we'll be hitting a lot of the families who are already coming there. Yeah, so.
Connect for the weekend, is that the idea?
Yeah,
This is that truck that got swarmed on Main Street? Okay.
Yeah.
That was from, those were from Safeway, right? The
No.
fruits and,
No, it comes over from
Klamath
Klamath Falls.
Falls, yeah.
Yeah,
Okay.
and it's open, it's for anybody, so.
Anybody
yeah.
can grab it.
Okay.
Yeah. So we're thinking it would be great to connect that with the summer lunch program. So it's really good, a lot of ideas, just all related to food access, nutrition and things.
And you're talking about the food bank in Klamath Falls? Because we don't have a food bank, we have a food share and a food pantry.
Yeah,
We
so
have the
it's
food
the
bank here, the gathering place.
Isn't that the food pantry?
That's the pantry.
Yeah.
And then, I know, it's so confusing,
Food
but they
pantry.
get their food from the food bank over in Klamath Falls.
Like I say, it is confusing with the
Yeah.
food bank, food share.
So, yes.
Food bank is the distribution center.
Which I think is important to recognize, Diane, that people who are hungry just can't eat fruits and vegetables either. So, you know,
That's right.
part of what we've been doing with the Frontier Veggie RX program is making sure they know when the food pantries are open
Right.
and, you know, other sources of food within the region of the other counties.
Definitely, yeah. Yeah, because I've been with Food Share for 15 years, and I don't always know when they're open.
And so that's actually, I think Michelle sent out an email, I think it was to you, Charlie, and then a bunch of other groups about getting the group together to kind of understand where all these groups intersect.
Michelle
Taughton,
Yeah.
yeah. And that was something that we had talked about in these Cooking Matters meetings, is that we want the recipes that we do in these cooking nights, we want it to make sense to the population that we're serving and know what foods they have access to, and then also be able to direct them to which programs are going on. But it seems like very few people have like a full grasp on how all of this is working in our community.
Brooke, have you thought about the Head Start for your classes, cooking classes?
Yeah, I think the culinary classroom at the high school would be our best bet, just because they each have their own like cooking
There's 5
station.
stations.
Yeah.
The only reason I think of that is the parents that have little kids might learn to cook better, sort of start earlier on the healthy food stuff.
Yeah, and like I said, right now we're
And
doing
they have a kitchen there.
They do, right.
Commercial kitchen.
Right, but we're hoping to be able to have them in their own little station so they can each cook as a family. Yeah, and so this time we're doing it's going to be school-age children and their parents or guardians, but we're looking into like how could this be continued, and I'll be gone, but how can we continue it, either doing it with just adults, because of course there's plenty of adults who maybe don't have kids or wouldn't want to bring their kid to something like this, or doing something that targets more WIC parents, so that would be much younger. Is it up to age 5? Okay. Yeah. And so it's harder if you have a class. It's nice to have a smaller, like a target age group, so you kind of know what you're working with, but it'd be nice to keep this going and do other things with it.
Thank you, Brooke. I think we are running out of time. There's another small update. If you look at your packet, the last document, so we are going to be having a oral screening clinic at the Streely Conference Room on May 21st. So we have a team of students coming from the OHSU school. And this is for people who are 70 years and older. So this is mainly pertaining to seniors as, so recently I've been hearing issues. We have a dentist in Lake County, but the office is set up in an RV and the seniors are having problems. It's not accessible for seniors. So this will be a good opportunity for seniors to kind of at least get screened. So yeah, just wanted to share that with the council.
So Medicare doesn't pay for oral health.
No.
So they come in and screen and find problems.
What are they gonna do?
Yeah, exactly. This is an IRB, this is a funded research study too.
I saw that too.
Which really, that's troubling to me that, I
Definitely.
mean, the ethics of screening without having help are,
Yeah.
I mean, that's why we weren't having people until a while back, our clinicians refused to screen for depression because they had nowhere to send people.
Yeah, yeah.
So I don't know.
Yeah, no.
Thanks for pointing that out. I didn't even know about these. So we had the older adult meeting this morning.
And all these people are gonna have to sign consent forms to go through this too.
To go to the IRB, so,
Yeah,
yeah.
so I'll get back to them, just, yeah.
So is it really just people 70 and over?
It was 75 years and older, they got special exception for Lake County.
Okay.
Yeah.
So at that, is there any chance
Yeah.
of identifying the Medicare population?
Yeah, for access.
You have an access, but I can't help you with that. But I just want to let you know. Good luck with that.
I just work for university, so I know.
Well, when they were talking.
Yeah, somebody more involved in this.
So that's all the CHIP updates. Christy couldn't be here.
Somebody died.
She's not well, and she didn't share the updates with me, so.
$150,000 so that every woman could get a mammogram for free.
Yeah. Okay, thank you everybody for coming, we're gonna go ahead and adjourn the meeting.